Good morning, class. This morning we want to do placenta delivery. So it's a procedure which is done in the third stage of labor. That's after the baby has been delivered. Now you have to deliver the placenta. So under OSC, it comes as a different procedure, meaning that you are supposed to just deliver the placenta only. So in this case, you are supposed to ask for permission and do all those necessary things that we do in OSC because it's a separate procedure. So how do we start? As usual, hand washing. So you have to get to the woman. So good morning, Mrs. Mulenga. I'm student number 2. I've been assigned to do placenta delivery. So may I please go ahead? Okay. She has said yes. Then what about you? You're sleeping. How is it? Of course, there is blood because she was in second stage. Now she's gone into third stage. So you can say that, and just for saying, obviously, but you know that there is blood. Okay. So at this moment, you have to go and prepare the solution for use. So in this case, we're going to use Savlon. That's for valve swabbing or cleaning the woman after you're done with the procedure. Okay, but then you're going to just deliver the placenta, and then for valve swabbing, you're going to just mention it or use one swab to show the examiner that you're going to do valve swabbing, because valve swabbing is also a different procedure. So at this particular time, you're going to scrub. Okay. So scrubbing as usual, that manner. Okay. So thereafter, you have to dry your hands. Okay. So you start from there, then you go up to there. Then the second corner goes behind your palm. Okay, in between. Then you go there. Then third corner has to go to this other palm there. Then fourth corner behind your palm. Okay, do that. And then discard this there. Then you can don gloves the usual way and hold there and slide in your fingers. Okay. Then you can go to the other one, hold like that, then do that. Then at this moment, you can just try to correct the fingers so that they are in their correct position. Okay. So once you do that, you can ask your assistant to expose the patient. So my assistant kindly expose the patient for me. Okay. Okay. So this is how you may find the procedure. So what you do is you stand in this direction. Of course, you have to wear a plastic apron and maybe some goggles or a mask, because there can be some splash somewhere if the woman is bleeding. So what you do now, at this moment when you come, you have to tell the examiner to say that you wait for the signs of placental separation or placenta separation. So the signs that you're going to mention are: 1, elongation of the cord. What I mean is that this cord is supposed to lengthen, like the length has to be more than the way you left it, meaning that there is elongation of the cord. Then another sign that you need to be aware of is a contraction, meaning that you're going to see a contraction on the abdomen there somewhere. So that is the second sign. The third sign that you should see is a gush of blood. So a gush of blood, meaning that you have seen blood coming out. Obviously, that's a gush, like you have seen, meaning that blood has come out. So there are 3 signs of placenta separation. So you should mention those. 1, a gush of blood. 2, elongation of the cord. 3, a contraction. So since those things have happened, what you're going to do is you're going to get the forceps and move it towards the placenta like that. Okay, from there where it was, you're going to unclamp it, then clamp there. Okay, once you clamp there, you're going to use what we call controlled cord traction, which is CCT. So controlled cord traction is the one you're going to use. Then you're going to hold the forceps like that. Okay, so you're going to hold it in this manner. Then you support this part here, which is the pubic area here. So you're going to support it. Then CCT, how it works, you're going to pull. Once you pull forward, you should go downwards. Then forward, downwards, forward, downwards, forward, downwards. That's CCT. So let me repeat. So I'm going to say forward, downwards, and forward, downwards, forward, downwards. So you're going to just keep on doing that, forward, downwards. So since the placenta has reached the vulva there, when it reaches there, you're going to rotate it. You're going to rotate it and then go in this manner so that you have complete delivery of the membranes. So at this moment, you rotate it so that the membranes are all delivered. That's what you do. Then once you do that, you remove it, meaning that this placenta now has to go for placenta examination. So which is another OSC procedure, which we'll do. You need to take this placenta for examination. You examine it. So at this moment, you're going to get a piece of gauze and try to go in the vagina and see. Try to see. We're assessing if the woman is bleeding. So you come out with maybe blood clots or so, and then try to see if there is any bleeding. So if there's any bleeding, you're going to suture or you're going to further examine the woman. So in this case, there is no bleeding. So what you do is you're going to clean the woman. So I'm going to even tell the examiner that I will do vulva swabbing or cleaning of the woman. So you just have to get maybe one swab and tell the examiner that I will clean the woman. Meaning that you clean the vulva, plus you are going to turn the woman behind there, going to clean and remove all soiled linen and the incontinent sheet. That's what we do. Then this placenta will go for examination. So tell the examiner that this placenta will be examined, meaning it's another procedure, right? So you just say that, okay. So that's what you do, and then you thank the woman. Thank you very much, Mrs. Mlenga, for allowing me to do this procedure. I was doing this procedure so that you're left comfortable and so that the placenta is delivered and all products of conception are removed. So thank you very much for allowing me. Then you go to the examiner and explain to the examiner that placenta delivery has been done and the woman has been left comfortable. Okay. So the last part is where you go to wash hands. So you do hand washing like that. Okay. And then you dry your hands. Okay. So at this moment, the procedure is done. So just keep practicing. It's a short procedure and very interesting. Okay. Thank you very much.